I am Sangeeta Dhawla, helping you today to understand the concept impulse control disorders. Now, what exactly are impulse control disorders? Let us take a look at them. A group of girls go to a shop to buy nail polishes. When all the girls are interested in trying out different shades, there is one particular girl who is very keenly observing the person across the counter who is showing them these different shades. Now, why do you think she is interested in that man? And she is observing him. At the right time, when she noticed that he was busily engaged with other girls, she very quickly and deftly pocketed one nail color into her pocket and then acted as if everything was pretty normal. After coming out of the shop, she flaunts this nail polish to her friends and feels so happy with the kind of admiration and adulation they shower on her. Now, do you think this is right? Is her behavior appropriate? You think there is something different? She is behaving differently? Yes, this is a kind of disorder. This compulsion to steal away things is called kleptomania. Let us just make an attempt to understand what are impulse control disorders. Impulse control disorders are a group of impulsive behaviors which people exhibit and are identified as psychiatric disorders. Impulse control disorder can best be defined as a failure to resist a temptation, a need or a drive to steal a particular object or to perform an act that is harmful to the individual. Now, this impulsive act is harmful to the individual as well as to the people surrounding him. There is a state of heightened alertness when the person is going to engage in the activity. For instance, when he is stealing a particular thing across the counter, he is really tensed, but when the act is over, he is relieved of all his tension and a sense of gratification fills him. One thing that we may note here is that this impulsive behavior is purely impulsive and there is nothing that is planned in this. You may also remember that this individual does not discuss that he is going to steal a nail polish, he is going to steal a pen or whatever with any of the people who have accompanied him to the shop. There are different types of impulse control disorders, and the first one that I am going to take you through is kleptomania. A person who suffers from kleptomania is termed as a kleptomaniac. Now, we will look into the various characteristics that these people exhibit. The person suffering from kleptomania fails repeatedly to resist the temptation to steal objects. How much ever he wants to stop himself from this behavior, he will not be able to do so successfully because it is the impulse that drives him at that moment and makes him steal the object. And one surprising fact with almost all the kleptomaniacs is that the object they have stolen will definitely not be used by them, but will be given away to the people who are there with him, or he just discards the object just like that, because at that moment what he is bothered about is to engage in the activity, experience the relief in tension and then the gratification. This heightened tension and immediate release of tension and the gratification are all what that gives him the high. How do you designate a person as a kleptomaniac? A person can be diagnosed as suffering from kleptomania if he is unsuccessful in resisting these repeated temptations. He experiences a great sense of relief before and after the stealing act. He feels really tensed before he is engaging in the activity, but once he is done with the act, he is thoroughly relieved of all the tension. You will find that the kleptomaniacs will not have a perfectly chalked out plan. Okay, I am going to go to this store, I am going to flick or steal this particular thing there or that specific thing. It is all that happens on the spur of the moment, and it is the impulse that drives these people to behave in the way they do. So, it is always as a surprise that when you come out of the shop or a place where you have been to with this person, to see that he has shoplifted so many things. But if it is just done for fun, it is fine, but if it is a disorder, it is really a matter of concern. Kleptomania may surface during childhood and it may continue till later stages in life. With proper intervention and treatment strategies, these people can be guided for a better living practice, and they can be taught how to overcome these particular impulses. Another impulse control disorder is pyromania. Pyromania can best be understood as a compulsive disorder with uncontrollable impulse to set fire without any ulterior motive. You can categorize a person as having this disorder if he has set fire like this in innumerable number of occasions. There is no ulterior motive at all behind this particular act of the individual, but it is the impulse that is driving him to behave in that manner, and it is the thrill that he gets out of engaging in such activity. You should note that this man is not driven for money, this man is not driven by anger, and he is not driven by revenge. He sets fire, a dangerous act, just because the impulse drives him to do so. Like kleptomania, even in pyromania, once this person sets fire, there is an immense sense of relief that fills him, and he becomes a very passive watcher. You will be surprised to learn that it is this pyromaniac who sets the false alarms and tries to attract the attention of the people around him, and will also stand as a bystander along with the others. So, like other types of impulse control disorders, there is heightened tension before he is performing the act, and once the act is performed, there is absolute relief and a great sense of gratification. Yet another type of impulse control disorder is compulsive gambling. We have heard a lot about in history and also have seen dynasties crumble down because of compulsive gambling. People who suffer from this disorder have an uncontrollable impulse to engage in gambling even after suffering very badly in terms of losses. And very often this compulsive gambling brings in a lot of strain between partners in terms of relationships and also strain in terms of finances, and it is basically because of this strain that is created the couples also part ways. The compulsive gambler is very well aware of this, but he is totally helpless because he cannot do anything about the impulse that is driving him so very badly. The Diagnostic Statistical Manual 3 has 9 criteria listed, and out of which even if 4 conditions are found in a particular person, then he can be designated as being a compulsive gambler. Now, we will take a look at all these criteria and try to understand what differentiates between a normal gambler and a compulsive gambler. If the person shows frequent preoccupation with gambling, or if he is always on the job to procure money that will help him in gambling, then you could say, yes, probably here is one reason that will help you in terming as a compulsive gambler. The compulsive gambler will feel an innate need to increase the size of the gambling amount. He is never satisfied playing at a certain level or a certain amount. He always wants to win more and he always wants to bet for higher amounts. And he shows lot of irritation and restlessness when he is restricted from participating in any such gambling activities. So, this irritation and restlessness are no way normal. If there is repeated loss of money by gambling and the gambler comes back in order to recoup the losses that he has made the previous day, then this also makes him as a potential compulsive gambler. There are repeated efforts by the compulsive gambler to quit gambling, but how many number of attempts he makes, he fails miserably and he finds himself again in the gambling zone. He needs to meet a lot of social and occupational obligations. But do you find him there really? No. What is he doing then? He is busily gambling elsewhere. He neglects all his social as well as occupational responsibilities. It is because of this obsession that he has for gambling that he has to compromise on his social, occupational as well as recreational activities. He knows very well that he is neck deep into debt, but does he stop at that? No. He engages further into gambling with a single premise in mind that once he wins, he can come out of his debt very easily. But does he win at all? No. This compulsive gambler is on a spree of losses. These are the 9 different criteria that will help you identify a gambler from a compulsive gambler. In case you find that any 4 of these conditions exist in the person, you may term him as a compulsive gambler. The main characteristic feature that majority of these compulsive gamblers show is that they lie. Yes, they lie and they do lie a lot for procuring money. With this money, what they do? Again engage in gambling. Very frequently, these compulsive gamblers are overconfident, highly energetic and get bored very easily, and at the same time, needless to say, they are very big spenders. So, that is about compulsive gambling. Now, we are going to another impulse control disorder. For a quick recap, we have seen what kleptomania is, we have seen what pyromania is, and we have seen and understood how a compulsive gambler could be identified. Now, we are going to look into what trichotillomania is. You have heard me right. Trichotillomania is an impulse control disorder which is characterized by the person's behavior, uncontrolled behavior to pluck or pull his hair. This plucking most frequently is restricted to the hair on his head, but in severe cases it does not end just at his hair on the head. It extends to his eyebrows, it extends to his eyelashes and some cases to body hair too. This compulsive act of pulling out the hair will result in partial or complete hair loss. Take a look at these pictures where the woman or the man, they have pulled out the hair on their scalp, they have pulled out the hair on their eyebrows and surprisingly on the eyelashes too. There is recurrent failure to resist the temptation, to resist the impulse to pull out one's hair. Like in the other impulse control disorders that we have seen in kleptomania or in pyromania, The individual who is suffering from trichotillomania 2 also is subjected to high levels of tension before he plucks out the hair and feels immensely relieved once he has finished plucking the hair. These people, they pluck out their hair and at the same time struggle to cover up or struggle to camouflage the loss they themselves have created. This occurs during childhood and also continues in the adulthood. It is considered to be more serious when it is spotted in the adulthood because it is during this period that you consider it as a serious psychiatric disorder which needs medical attention as well as counseling. The amount of hair loss depends on the frequency with which the trichotillomaniac plucks at his hair. And yes, after plucking the hair, they try to camouflage it with the help of wigs, hairdos or some other lovely wonderful things that can not give out that they do not have hair in that particular place. It is found that this disorder also occurs along with other disorders like the obsessive compulsive disorders, substance abuse disorders or eating disorders. That is as far as trichotillomania is concerned. So far we have seen what kleptomania is, pyromania is, compulsive gambling is, trichotillomania is. Now comes another impulse control disorder called the intermittent explosive disorder. What is this? The intermittent explosive disorder. In this type of disorder, the individual lacks the ability to control violent and aggressive impulses which result in serious destruction of property as well as assaultive acts. The violence that this individual shows is purely episodic and is not at all continuous. That is the main characteristic feature of this intermittent explosive disorders. As the name indicates, it shows in intermittently. He gets into these aggressive impulses only by reflex and he does not have any kind of control over his behavior. It is this awareness that the person has over his inability to have a control over his behavior makes him feel absolutely distressed and helpless. In some cases, the intermittent explosive condition is accompanied by some physiological reactions that take place within the body. The individual might experience palpitations, heightened blood pressure or a tingling sensation in the stomach. A few others report as having a very bad mood, they suddenly feel exhausted or they feel they are sapped out of energy totally. So, regardless of whether it is kleptomania, pyromania, compulsive gambling, trichotillomania or intermittent explosive disorder, all these are a matter of great concern which need immediate attention as well as treatment. The treatment will help the individual overcome his distress, anxiety and many other related problems. When we are talking about the treatment aspect, what do you think can best be given to a person who is suffering from the impulse control disorder? Yes, of course, the medicines or the medication and then counseling, which will definitely help the person overcome his problem easily because he will be working in close quarters with the counselor who will be very supportive of him and help him overcome the disorder. As far as counseling is concerned, cognitive behavior therapy is found to be highly result oriented because it combines the cognitive therapy as well as the behavior therapy which will help the person overcome his problem. Cognitive therapy helps him bring about a change in the way he thinks about himself, in the way he thinks about the disorder. The behavior therapy helps him to adapt to ways that will help him overcome the problem behavior. Treatment is carried out in different steps. First, a detailed assessment is conducted, and then relevant education is provided to the person suffering from the disorder. It is the duty of the treatment provider to identify which coping skills would be apt for this individual to overcome his kind of a problem. Then he will challenge these disturbing and distressing thoughts. Over a period of time, when he successfully works with the counselor and makes the changes that are suggested to him, he will be able to avert such kind of damaging experiences. He will be able to avert such damaging behaviors. The treatment will help him get a better control over his thoughts as well as behaviors. It is the counselor who will be able to monitor very closely whether the individual is experiencing any problem during the counseling process, identify the problem area and equip him with the skills that will make the transition smooth for the individual. Any of these conditions can be a cause of great embarrassment to the individual himself, and it is this embarrassment which will stop him from expressing it to others. But if he really wants to get out of this problem, opening up to his closest of friends or parents or someone nearby who could help him will really help him in tackling the problem effectively. So, whether it is the individual himself or his parents or his extended family, whoever, they could just identify the problem, guide him in the right direction so that regardless of the kind of impulse control disorder the person is suffering from, he will be able to shown a way to tackle his disorder in an effective manner. So, this has been our chapter for today, impulse control disorder. I hope you all have enjoyed it, and a quick brush through of what we have done. We have identified 5 different types of impulse control disorders: kleptomania, pyromania, compulsive gambling, trichotillomania and intermittent explosive disorders. We then went on to see what kind of treatment options would be effective for the individual. We have seen that medication and counseling in the form of cognitive behavior therapy are found to be very effective in helping the persons suffering from impulse control disorders.